Wildfires tear through LA with millions at risk of the harmful fumes.
City officials say hydrants unable to keep up with the extreme demand.
Destruction, block after block.
Local officials are saying at least 5 people have now died.
You can just see these flames bursting out of these windows.
And you can look straight through the front door. That is an apocalyptic scene.
Evacuate early, grab your things, grab your belongings, grab your family, and get out.
Discussing the health consequences of wildfires means we're discussing the health consequences of air pollution. Air pollution is the #2 cause of death worldwide. We're gathering experts for this episode to tell you why. Your lung is the constant open window which allows your environment 24-hour access. If you live in a heavily polluted area, constant 24-hour exposure significantly contributes to the development of disease, lung disease, heart disease, diabetes, and neurological disorders. The increased concentration of particulate matter from sources like burning structures, auto exhaust, and industrial factories raises mortality rates. So much so that we have to talk about this.
We're going to discuss how it affects your body, what to watch out for, and what you can control. Welcome to the Health Exchange.
So we're here with a very special guest today, another national spokesperson for the American Lung Association, Dr. Felix Aguilar. How are you?
So good to be here in difficult times and trying times. Thank you for having me this afternoon.
Yeah, no, I really appreciate you being here. You're a family practice doctor in the Pasadena area, is that right?
That is correct. I'm also a spokesperson for the American Cancer Society, and I happen to both live in the Pasadena area, and also I'm the quality medical director for LA Care. So a lot of our members live in the area, and it is a trying time, a difficult time for a lot of us. My wife and I, we don't live in the evacuation area, but we were ready to evacuate.
Yeah.
You know, we had our to-go bags, and my daughter has asthma. And so we will make sure that she had her medications, both her rescue and control medications, and staying indoors because the air quality was horrible.
Yeah.
And so I talk both as a doctor and as a concerned parent.
Yeah. Yeah. When you look at the air, when we're talking air pollution, what does that mean to you when you're on camera and you're doing a media interview and you're talking air pollution? Like, what does that mean? What does that consist of?
Well, air pollution, of course, we can see it, right? We can see smog, but it has multiple qualities, right? One of them, of course, is particulate matter, right? Particulate matter, and I'm going to refer as PM.
Mm-hmm.
So there's mainly 2 parts, PM10, which is the microns, which are the larger pieces, and there's a very tiny 2.5, which are the very, very tiny ones.
Mm-hmm.
The PM10s can be caught in your mucus. The 2.5 is so tiny that they get stuck inside your lungs.
Mm-hmm.
Yeah.
So that's the first part.
Mm-hmm.
And so the wildfires, and the reason I bring particulate matter is because, you know, you get all this burning materials, you're burning houses.
Yeah.
I'm so sorry to say that because I have friends and others that lost their homes. You know, there's a ton of particulate matter in the air. So that can get caught in people's lungs. So the particulate matter is significant. And that is a huge irritant for people with asthma, for example.
Yeah.
I mentioned my daughter or patients of mine. I've been in practice for 28 years. So that's a huge irritant.
Yeah.
But then there's the NOx, the nitrous dioxide or oxide.
Mm-hmm.
But basically a lot of those, the gaseous parts that are also irritants, both for people who have asthma or pulmonary disease.
Right.
Yep.
You mentioned how that is one of the main reasons why mortality or respiratory diseases through these times are one of the main reasons why people ended up in the ER or hospitalizations.
Yeah.
Tremendous importance that we pay attention. Asthma is one of the main reasons why kids miss school.
Right.
Mm-hmm.
Even now that the fires are happening.
Yeah.
But just in regular times, one of the main reasons why people miss schools or their parents miss work.
Yeah.
You know, when he's talking about particulate matter, there are really 6 components of air pollution. There's particulate matter, which we divide into 2.5 and 10. We also have carbon monoxide, nitric oxide, sulfur dioxide, and lead.
So true.
Yeah, these are the different components of air pollution, right? And so these are the different molecules that are contributing to the damage that you're talking about and increasing the amount of inflammation within your lung, right? The other thing that Dr. Aguilar mentioned is he mentioned the different sizes of these particulate matters, right? Because when things burn, you don't know how big or small these molecules are going to be. So you've got a bunch of solid liquids and gases that all have these different sizes and even different shapes. And so what does that mean to our lung? So as he said, when you have a PM10, it can get caught by the cilia and the mucus that line your respiratory cells, your airway epithelial cells. But even further, as those molecules shrink and get smaller, then they diffuse across the membrane where oxygen is supposed to go, and they get in your bloodstream.
That is correct.
You know, a lot of people look at this and they're like, oh, it's just my lung. I'm just going to have an asthma attack, or it's just going to affect my lung. But that's not the case.
That is correct.
Yeah.
And then that's the reason why lung cancer, right? That's one of the reasons why this is one of the reasons we get these diseases, and we have other issues. And the global climate crisis that we're going through, we're going to see more of this, because why are we having wildfires in the middle of winter?
Right.
California usually get wildfires summer or fall.
August,
that's a natural occurrence of these fires. We expect them to occur.
Right.
But January is not the time for this to be occurring. Now we have the one of the worst fires ever to occur in our state.
Yeah.
I hope that we're bringing this message to our patients, to people who listen to us, not only to bring you down, but to give you tools to empower you, because it's so easy to say, oh my God, what am I going to do now? Right? It's also to show you, okay, so this is the situation, what do we do now? Right? For example, for my patients with asthma or the diseases, is how they can control their conditions. So if they have asthma or other pulmonary diseases, in situations like this, stay home. You can also, there are websites that give you the air quality index, which is the air quality index is a number that allows you to see how bad the air is outside. Now, yesterday around my house, it was 195.
Right.
Now, if you don't have any context, it should be less than 30. Right. This is now over 6 times the normal, right? If you have to go outside, you can use the masks, preferably the N95s. But if you don't, any kind of mask will provide some protection, and always ensure to use your medications. Right. Those are things that we can all do personally.
Sav, when you've had experience in a wildfire situation, right?
First and foremost, I just want to say I think all of our hearts go out to everyone in the Los Angeles area that's been affected by this, including the first responders, including the community in its entirety. This haunts me. It takes me back to 2017 when we had the Thomas Fire in the Ventura County area. And that fire is where I live, and it burnt over 300 acres. And most recently, we've had some significant fires in the Camarillo area as well, and we've lost a substantial amount of homes during that fire. At the time of the Thomas fire, I was working as an ICU nurse. And I have these very vivid memories of sitting in the ICU with patients that were intubated, and we weren't going anywhere. The whole city essentially was evacuated. And I'm looking out the window of my patient's room, and it was this beautiful green hillside. And now it was just lit up orange and red. And if you've been that close to a wildfire, it feels like it's right in front of you. The whole room was lit up with the light from these fires. And on top of that, the entire hospital was filled with smoke. And we were working in those conditions. We couldn't leave. And I remember sitting there looking out the window over my patient and just having this overwhelming feeling of sadness and dread and frustration and anger. And it was in those feelings that we came together as a community, right? And I mean, the nurses, the doctors, the first responders, the patients, we were leaning in on one another to build a form of community within this hospital. Mm-hmm. And in that, we found so much humanity and resilience. And I think that Los Angeles right now is going through something that there's just no words to express how devastating this is. But I really believe that LA is going to come together in a way that I don't think LA has ever come together as a community. And I know that's what it was for our home. We are so much stronger when we are together. And when we come together as a community, there's healing. I think that that's the message that we have to push forward to see Los Angeles get through this. So that's my takeaway from the Thomas fire. We're going to get through this.
When Savannah was talking about being exposed to smoke inside the building, being exposed to smoke outside, seeing all of the evidence of a wildfire when you're outside, and you heard Dr. Aguilar mention the air quality index, which I'm sure is something that most of you who are probably listening haven't really paid too much attention to. The range is from 0 to 500. And as Dr. Aguilar was saying, he said that around his area it was 195. Now, here's what we say, is as you approach 100, that's when healthy people who have no chronic medical problems, no medical history, that's when they're going to start feeling symptoms, right? And what are those symptoms going to be? Well, people are going to cough. Yeah. People are going to be short of breath. People might have a headache. And that's when you have to start thinking about, just because you have no medical problems doesn't mean that you are not vulnerable. And so there are vulnerable members of healthy populations. And Dr. Aguilar, those vulnerable members include which groups of people?
Well, of course, the young.
Yes.
Because they're still developing, especially babies or young people. Their lungs are still in development. People with pulmonary disease, if you have asthma or COPD, chronic obstructive pulmonary disease, or if you have any immune disease, so it's any specific disease like cancer or any of those. Yeah. So any of those folks, you should always be specifically careful, with babies, elderly, or if you have any other diseases. And if you have asthma or any of those, always make sure to have your medications ahead of time.
Again, another group of vulnerable patients. So like Dr. Aguilar said, he had said, the young, anybody from age 0 to 5. He had said the elderly, anybody who's over the age of 60. Also pregnant females, though that's another group.
Very good point.
That's another group of individuals who are at risk, even though they have no chronic medical problem. When we look at wildfires, we think of the acute effects, and we mention the acute lung effects.
Yes.
Right? Obviously, because you're inhaling that smoke, there's going to be lung effects.
Yes.
Carbon monoxide, that also causes issues, doesn't it?
Of course. Carbon monoxide, it's a well-known irritant of the lung tissue. So obviously, you have the acute effects of the fires, and also long-term effects.
Yeah.
Because you have a damage to that lung tissue that will remain for a while. I mean, we know that long-term exposure to air pollution has long-term effects that are both cardiovascular, diabetes, neurological too. I mean, there is increased risk of dementia, Parkinson's, as you said. There's a number of these conditions of exposure to air pollution, and now, of course, wildfires.
Yeah. I feel like I wouldn't be complete if I didn't talk about carbon monoxide poisoning.
Oh, of course.
All right. Carbon monoxide poisoning. So carbon monoxide is a gas, and when you inhale this molecule, what it actually does is it binds all of your oxygen. It takes it away from the hemoglobin that's supposed to be carrying the oxygen in your bloodstream. And as a result of that, you start to get a headache, and then the headache can get worse, and you can actually go into a coma. And the way to actually treat it is to basically put you on oxygen and support you. So we have to remember that. So if you're in the wildfire right now and you're having a massive headache and you're somebody that never has headaches, that's an issue. That's an alarm sign. That's something where you do need to go be seen by an ER physician just to make certain that your carbon monoxide level in your bloodstream isn't too high. Dr. Aguilar was talking about the long-term effects of air pollution. And we see this in heavily polluted areas all across the world. When you look specifically at the United States, heavily polluted area is right where we are right now, surrounding Long Beach and LA, right? This is heavy pollution in California. It's number one for ozone, which is another molecule we'll pay attention to. But it's number one for ozone. It's also number 6 and number 11, respectively, for acute and long-term particulate matter concentration. So that means that over the course of time, you have an increased concentration of particulate matter, but also acutely, you have an increased concentration of that particulate matter.
So we know that exposure to air pollution, specifically wildfire smoke, is linked to a risk of cardiovascular disease. This has been studied pretty extensively. As we're talking about wildfire smoke and PM 2.5, we know that this embeds deep into the lungs and it can get into our bloodstream. When we see it get into the bloodstream, your body has, and you mentioned this, a systemic inflammatory response. So it's releasing immune cells called macrophages. This then initiates what we call inflammatory cytokines. And when your body has this kind of chronic inflammation, it can actually promote atherosclerosis. So that's buildup of plaque in the arteries of the heart. This can lead to heart attacks and strokes for patients. Also, if you have patients who already have risk of cardiovascular disease, or they've had perhaps, say, a heart attack in the past, or risk factors for cardiovascular disease, so high blood pressure, high cholesterol, diabetes, obesity, we see that these patients' risk of heart attack and stroke goes up even more so. When we breathe in these air pollutants, it disrupts our autonomic nervous system. And our autonomic nervous system is responsible for managing parts of the body like our heart rate, our breathing. When we see a disruption like this, it can cause arrhythmias with the heart when the heart can't beat appropriately. And some of these arrhythmias can actually be very dangerous. They can be lethal. We also see when there's a disruption of the autonomic nervous system, the heart rate goes up, the blood pressure goes up. So patients who are chronically having elevated heart rates, elevated blood pressure, are at an even higher risk for a cardiovascular event. There was a study that actually came out in 2020, I believe, where patients who had long-term exposure to wildfire smoke had an increased mortality rate of upwards of 10 to 15% based off of cardiovascular disease. And then they did a repeat study a year later in 2021 that showed even if patients had a short-term exposure to wildfire smoke, they had increased ER visits, but related to cardiovascular. So we're talking about this and how serious the wildfire smoke affects our lungs, but we know that it can also cause significant damage to our heart as well.
When you look at your environment, right, which includes air pollution, that has a serious health impact on what's going on inside of your body. And so it is not right, surprising when you read the data to understand that when you have this acute increase in wildfire smoke, you're going to see not only more respiratory disease, but you're going to see more heart disease.
Yeah.
You're going to see more neurologic disease. And you're also going to see more endocrine disease, because when you burn plastic, you're creating these polycyclic aromatic hydrocarbons, and these molecules also worsen diabetes. And it's really, really interesting when you look and then you understand that, oh my gosh, when you live in a place like California, when you live in Southern California, in a heavily polluted area, you just want to make sure your patients understand the risks. If I had a patient that had coronary disease,
Yes.
I would let them know, hey, listen, if they say evacuate, you especially
Need to get out of there.
right?
Yeah.
So true.
I mean, there are individuals out there who have lost their house. They've lost their shelter. They've lost family members as the death toll is going up. We can't also rule out the fact that these individuals are going to have significant mental health concerns. They're going to be depressed. They're going to go through periods of grief as a result of people losing their house.
This feeling isn't going to go away the second that the fire is contained, right? Because then we're going to look at the aftermath, and this is going to be with us forever. And I think we're always going to hold on to some of that pain. But comparable to other aspects of life where we have to hold on to pain, it can make us so much stronger.
Yeah. And I know people want advice on what they can do acutely in terms of how do we reduce the exposure of the particulate matter that's in the air. Well, one of the things that you can do is you can wear a surgical mask, which reduces your exposure by about 20%. You can wear an N95 mask, which reduces your exposure by about 80%. All a mask does is it just physically blocks the amount of particles that you're breathing in. You guys have surgical masks and N95 masks at home, so you can do that. Air purifiers are very helpful here. You can use those indoors, right? Turn on the air purifier. It will clean the environment. Read the box and see what the radius that they gave you or the amount of square feet that they're giving you that's going to clear that environment. Turning on your air conditioning. It recirculates indoor air, so it keeps the air cleaner on the inside. Close all of the windows and shut all of the doors of your house, because that pollution can seep in. If you have your windows and your doors shut, that's going to help keep the air that you're breathing inside cleaner. The other thing to do is to stay hydrated. A lot of individuals, when there's a lot of smoke and fire outside, it's hotter, people are getting more and more dehydrated. You want to make sure you stay hydrated so your body can function as efficiently as it needs to and protect the vulnerable. Right? If you have a kid that's 0 to 5, newborn to 5 years old, if you have to go outside for a significant period of time, try to put a mask over them. Try to keep their environment clean, or just don't go outside. Same thing for the elderly, people over 60 years old, and pregnant females, in addition to people that have comorbidities. I've never talked about this before. It was about 3 years ago. So I live in South Orange County. In South Orange County, there's a lot of brush fires, a lot of fires, and the fires extend, they get bigger, and I live up against a mountain, so there's a lot of area there for it to burn. And the big fire started, and we had to evacuate. And my kids at the time were probably like 6 and 4. No, they're a little bit older, maybe 6 and 8. And I remember, and I'm kind of how I always am. I'm just calm. And so I'm like walking out of the house, we're being evacuated, going to my mom's house in Laguna Beach. And when you walk out of the front door of my house, you can see the fire, right? You can see the fire and you can see the smoke in like several different patches right in front of me. And my daughters, because I was walking to the car, they were in the car with my wife, and my daughters were like, "Dad, come on, you're gonna burn, hurry up, come on." And they still talk about that event to this day, because it really traumatized them. It really did. Like, there's a certain amount of stress that I'm used to running around in the ICU all of the time. But for my kids who barely know the world, seeing them go through that trauma
Mm-hmm.
and remembering it in detail to this day,
Yeah.
them knowing how slow I was walking and making sure that, I don't know, like things were taken care of. And I just remember it in the back of my mind. And so I can't imagine losing a house.
Mm.
And I'm the dad, right? And so like, you know, we've had guests in the past that have said things about responsibility and all that. I'm a responsible guy, and I feel like I have to provide. If I lost my house, I don't know how I would take that. But I know that my kids would probably take it a lot harder than I would. And that's the kind of stress that can contribute to depression, that can contribute to grief. And I think it's important to provide support for those families and for those individuals that are going through something like that. And I know you've had friends, Dr. Aguilar.
Oh my gosh. Yes, of course. Just in the last couple of days when my best friend who lives in, since I was a kid, when they let us know that they lost their house, we spent Christmas with them. Christmas Day, we were with them in that same house, and now it's gone. I was in shock.
Wow.
And again, of course, from my personal point of view, I always recommend to limit news, social media to the minimum, because there's a shock value to this stuff. You know, I'm telling you my own personal reaction, and I was like kind of taken aback of how I was like, oh my God, this is so wrenching for me. And I cannot imagine the people who truly have lost their homes. Some of them died trying to save their homes. I read that some folks were, there was a man who had lived there since he was a kid and felt very attached to their home. And so he was trying to put the fire with a hose and got smoke inhalation. You know, you were talking about CO2 poisoning. And that's exactly what that is,
Yeah.
right?
Carbon monoxide poisoning.
Carbon monoxide poisoning, smoke inhalation, and that kind of situations are horrible because they're just...
It's awful.
Yeah.
It's
And
awful.
we get what you're trying to do, but we want you to be safe
Yeah.
from a health perspective. So if you're told to evacuate, it's because the fire is headed that way. And take your valuable objects, but protect yourself, protect your heart, protect your lungs, protect your brain, protect you. Because if you're a father, a brother, a son, a cousin, a wife, a daughter, you know, an aunt, a mother, a grandmother, like we want you to continue to be that. And as hard as it is to lose a home, I still want to be able to say, Mom. I still want to be able to say, you know, hey, brother. So just take that into account too. I know you want to protect your home, but protect yourself. I think that's of the utmost importance.
So I know a question that a lot of people are going to want to have answered. If you have had exposure to wildfire smoke, and let's say it's short-term versus long-term, and I don't know if we can even put a time frame on that, are the consequences long-term? Will they ever get better?
It's a great question. You will get better from that acute exposure. You will get better. The inflammation can calm down. Your symptoms will get better over the course of time. That's very true. But when you live in California and you've got significant air pollution that already surrounds you, that you're chronically exposed to, yeah, your mortality went up. We know that particulate matter 2.5 that's created from wildfires is worse for your health, especially in kids, than particulate matter 2.5 that's there chronically. We know that the acute exposure makes you worse and is worse. So I think that, yes, you can therapeutically manage these individuals, but there is a health consequence in the long term, getting that acute short-term exposure. And I think that's part of why we're here, is to create that awareness surrounding that.
Yeah.
Right? I can't tell you how many firefighters from 9/11 that have moved to California that I've taken care of that have chronic lung disease as a result of that exposure.
I see the same patients and they have cardiovascular disease.
Exactly.
I think there was actually a study recently, you and I were discussing this, that mortality, so death from inhalation of smoke, is substantially higher in patients with cardiovascular disease than even respiratory.
Correct. Yeah.
Right. I think and you might know this better than I do, but I think the percentage was something like the respiratory was like 20 to 29.
Yeah.
Cardiovascular was as high as like 60, 69%.
Yeah. Because I mean, again, cardiovascular disease was the number one killer like worldwide, right? So I mean, of course it would be, but yeah, that's something that's very important for all of us to take away.
Yeah. So a question I have for you is I'm getting phone calls from patients that are saying, I haven't yet been evacuated, though I'm perhaps close to evacuation zone. Am I at risk of the air pollution from the wildfire smoke? What should those people be looking to do?
Now, it's a personal decision, because if you feel like, my health is a concern, or I have little kids or elderly, there's many factors to that answer. It's not, I cannot just say, oh yeah, you're close to an evacuation zone, you should leave. Now, if you have an evacuation or you live in evacuations warning zone, go. Again, there's not a right or wrong answer in those situations.
Yeah.
Just to clarify, if you're, far away from a fire, but the smoke and the ash is pouring down on you.
Yeah.
Okay. What should those people do? What should I have done? Do I need to leave? Is this going to be horribly harmful to my lungs and my kids? Do I wear a mask? What's the answer?
So I think for somebody that has a chronic inflammatory lung disease, if you have asthma, if you have COPD, yeah, get away from the ash and from the smoke, because if you can, get away from it, because it can acutely affect you, and it's definitely going to chronically affect you. So try to go away until that air quality index number is back in that 100 or less range. Try to get away from the smoke, because this wildfire smoke is affecting 18 million Southern California residents.
So people outside of California are watching the news. They're seeing all of this destruction. I have people calling me saying, is this really what's going on? Are they just showing the worst images? How significant for people who, we know here, but for people who are not in California, how significant is this fire in comparison to fires that we've had last year and the year before that?
This is the worst fire in Los Angeles County history. It is the worst fire, the most destruction. It's the worst, and it's not over, and it's still going on, which is why you're seeing all these news clips. This is something that requires serious action, which is why the president is here, which is why the governor is down here and involved, because this is serious. This is the most damaging fire in Los Angeles history. People are asking why. So Dr. Aguilar, why?
It is the most cataclysmic fire in Los Angeles history, because it is a perfect firestorm. We are having the Savannah winds, which are these 80 to 100 mile winds in the middle of the winter. Usually we have fire season, which is I wouldn't say normal, but regular in California in the summer or the early fall. But we are in January. And we have been told by climatologists that last year was the warmest year in record in the world. And now all of these things basically collided, and we get these 180 to 100 mile winds blowing on the fire. And from one day to another, basically started at 10 a.m. on Tuesday morning with the Palisades fire. And by 6 p.m. with the Eaton fire, it was just a firestorm. And all of us who live in the LA area suddenly were like, what? And from one fire to another, sunset fire, the wildfire, it's just been, all of these elements have come together to create this cataclysmic situation in which now we have over 10,000 buildings and homes destroyed. Our heart goes to everybody who's been hurt, and all of us have been affected. Will take a long time to recover. As Savannah has said, thank you for your words of hope, that we will come out stronger. And at this moment, the moment of challenge, those are important words. Thank you.
Thank you.
I want you guys to imagine a flame. And as this flame is burning, the structure that's burning, the molecules that consist of this structure are getting smaller and smaller and smaller. And then you get a gust of wind. And as this gust of wind blows, now this structure, which is now tinier, can suspend in air because it's lighter. It's been burned. And the wind is going to blow it across a freeway or across a street. But the flame is still ongoing. And then that flame and that structure land on more dry land. And now that dry land can burn. This is why 80 to 100 mile per hour winds creates this perfect storm. And this is why this fire is extremely damaging, because you have things like this happening and these fires are jumping all over the place. And that is what makes this situation extremely dangerous, or that's what did make this situation ridiculously dangerous because of those winds.
Once we look into the future, once these fires are under control, we've put them out, and we're facing the aftermath, how long does the wildfire smoke, how long is it dangerous for us?
When I think about this question, the fire can be extinguished. However, the consequences of the structures that were burned are not extinguished. And these particulate matter molecules live in our air, suspended for years, affecting the lung, affecting the heart, affecting the brain, affecting the skin, affecting your car. And we have to understand as a society that air pollution contributes to our health. It just does. This is going to be present for years. What we want individuals to understand is, because we know that air pollution is the #2 killer worldwide, I want you to know your medical history. And if you have comorbidities like asthma, COPD, coronary artery disease, I want to make sure you have access to your provider. We want to make sure that you have access to your medications so that you can continue living your healthy life.
Is it true too that when we're cleaning up all of this, which I can't even, I can't even fathom how long that's going to take and what that's going to look like, but that's just releasing all of this PM 2.5 as well, right? We're just putting it back into the air. That's going to make this process even longer.
Yeah, when you pick up disintegrated structures, it's dust.
Right.
And the person that's picking up that dust, if they're not appropriately protecting themselves, they're just inhaling those particles again, which causes damage and inflammation and scarring in your lung and inflammation in the bloodstream, leading to everything you talked about so perfectly with the heart. And that's what we want people to understand. And that's why we exchange information with Dr. Aguilar,
right,
with Savannah Shiles and all of our other guests, because we want you to understand the consequences of what's in our environment and how it impacts your health. But we also want to talk about positive things and positive efforts that are put into society. Here's a positive pulse from a few years ago. It was a 38-year-old male who was admitted to the intensive care unit with pneumonia. It was right after a wildfire situation. This gentleman was not improving. He was on antibiotics. He was on the ventilator. I had to intubate and put him on a ventilator. I was sitting at the table one day and I was thinking about it, and it was right after I became a spokesperson for the American Lung Association. And I was like, wait a second, he was in a fire. The fire was in the hills, there's dirt, there's fungal spores in the air. And I thought about a fungal pneumonia, and we got him started on an antifungal. And the patient began to improve. He was able to be extubated and he was able to get home. And that's something for me, because of the opportunity that the American Lung Association gave me to be a national spokesperson, that allowed me to pick up something new and to help people in our community, which is what we are all trying to provide. We really appreciate you guys being here on The Health Exchange. Please follow us on Instagram at The Health Exchange. Subscribe to us on YouTube. And again, if you have any questions regarding air pollution itself, you can start on lung.org and look for air pollution. Thanks for joining us.